Well, welcome back to the channel. It's Dr. Durst, and today I have a special guest with me, and it's Greg McKettrick.
Thank you very much. I'm very happy to be here. As Dr. Durst said, I am Greg McKettrick. I'm a pharmacist and have been for over 35 years. I come from a strong compounding background, so very familiar with the ins and outs and rules and guidelines. I currently am with Revelation Pharma, which is a network of 20 compounding pharmacies all over the country. I don't actually work in the pharmacies these days. I run menshealth, so I'm a clinical liaison. I educate our staff, I educate patients, and I educate our physicians, do in-services and seminars, speak at a lot of conferences, those sorts of things. I'm also a medical advisor for the BHRT Training Academy, which that's bioidentical hormone replacement therapy. And what we do is we work with prescribers, train them in all different aspects, different realms as far as compounding, hormone, sexual medicine, you name it. I am very intimately working with nitric oxide. I have for a very long time, still on the advisory board with Berkeley Life, but I also work with Approved Medical Solutions. I also am now adjunct faculty with the Peptide University, which is a wonderful thing. It helps me to understand better and help to educate patients as far as the use, application, and introduction of peptides into practices, especially for clinicians. So yeah, lots of different things going on.
Lots of different things. I love it.
Pretty busy, which is how I like it.
Yes. Well, we'll dive into a few different things. There's a multitude and probably endless amounts of things you can speak about. Again, it comes down to a lot of the people even talking about the FDA and the black box don't even know the details of what we're talking about. Right. USP, like federal regulation, state regulation, or even just the fact that sterile versus non-sterile, and what it takes to do that. And now some of the degrees are PharmDs. Like when I went through, it was a 5-year. It was a 1 and 4 or 2 and 3, but it's much longer now. And it is a very difficult education. And by the time you're actually doing anything from an injectable standpoint, that's a big operation with lots of money. You are correct. So
kind of touch on that. I do some teaching at High Point University in their pharmacy program. So I teach a couple of things. I teach basically differentiating legalities and oversight for the different types of pharmacies, 503A, which is your patient-specific compounding pharmacy, versus a 503B, which is a manufacturing or outsourcing pharmacy. And then I talk about different dosage forms for different therapeutic categories. And I talk in detail. I give a BPH speech. I talk about men's health. And even though the pharmacy school, and again, I'm not even talking about medical school, I'm talking about pharmacy school, where they do teach the compounding, the layers of information that can be added in, and just the edification in terms of the detail, what comes from real world that can be implemented into that setting, it's phenomenal. So we do a tremendous amount, and like I said, it's something that it's very gratifying, number one, because we're problem solvers. But
I agree.
There's a lot that goes on, and I mentioned we talked about black box. So they just removed the black box from the hormone replacement therapy, but back a year ago, I was doing research and ran across something. Again, just this was happenstance, but the only reason I found it was because I was trying to mitigate side effects for patients and come together with some different dosage ideas. But I stumbled across what was called the Post-finasteride syndrome. And if you're not familiar with it, finasteride, that's like Proscar and Avodart. This is a medication that's used for BPH. It's used for hair loss, very commonly, Propecia. Well, I started doing some digging into this, and I was really looking to adjust dosage because the drug is known to cause sexual dysfunction in men who use it. Well, turns out that's kind of the very gloss over, because it also causes permanent neurological damage, causes physiological damage, psychological damage, emotional damage, plus the sexual dysfunction. And in fact, it leads to a very high rate of suicide. So back before our government did anything, there were 30 countries around the world that were blackboxing or banning finasteride. And I presented this at a university, and everybody in there, including the professors, looked at me like I had a third eye growing out of my forehead. And then, sure
Mhm.
enough, about 6 months later, our FDA black box finasteride. So, you
Mhm.
know, it's funny how sometimes we discover things because we're trying to solve a problem, and that leads us down a path that it's a discovery path, and that's where I think a lot of the really great stuff comes out.
Yeah, well, I actually think that brings just one more point, which I think is an important one, is that discovery happens over time, right? And with FDA approved products, FDA approval doesn't equal safety
Yep.
because there are FDA approved products that are have a black box warning on them after for things that have been discovered or pulled from the market with lots of morbidity and mortality associated with something that was once FDA approved. So it's not perfect. It's not a forever. And there's a discovery over time. So it's not like an FDA approval automatically equals safety because discovery can happen over time. We have implantable surgical devices that have been removed with morbidity and mortality that have been FDA approved. So I'm just of the strong factual opinion, and we have, facts and truth on that side. Is that it's a discovery over time, and if they discover something to be unsafe later or it causes issues, then it will be pulled or put a black boxes on it. So anyhow, I
Well,
agree with you.
I always laugh because one of the common statements is if someone were trying to bring aspirin to market today, it'd
Hmm.
never get it would never make it through. And here it is on every OTC shelf in the country. But
Yes.
again, it's one of these drugs that can cause so much damage and has harm and interactions and everything else. So yeah, you think about things, and yeah, sometimes there's practical application of what we call anecdotal medical
Hmm.
science information, and that actually leads into the research where we start to get the real deep dive factual information.
Yes. No, I agree. And one of the other things, and then that we can call, FDA, or not FDA, but compounding pharmacies, again, super safe, super regulated. And again, they're allow us to customize. And I'll just give an example for even a breast cancer patient that might not be able to do estrogen. There are options vaginally. Obviously, they talk about options vaginally, and there's some conventional products,
Mhm.
but you can combine even, it doesn't even have to be an estriol, which could be used, but a DHEA. You can combine it with different vitamins, with hyaluronic acid.
Yep.
So it gives us complete non hormonal options in combinations that are safe, that meet all those standards of compounding. It allows us to get a product you cannot find
Yep.
conventionally prepared. So it just allows us to treat women and men in so many different ways. And again, you bring up finasteride. There's so many workarounds with it too, when you can
Yep.
compound and do it differently and topically. So no, I think those answer. Do you think there's any other questions that like are commonly asked? I know the regulations, and obviously FDA approval just means like what you're saying, that they're taking a specific form or concentration, they're approving that product. But if you are still using that same chemical formulation, but changing it a little bit for allergies or better, or combining it with something, it just allows us to customize and to broaden our treatment
Well,
options
and
for patients.
another thing I think that's definitely worthwhile noting is that for a chemical, for a compound to be legal, for a
Hmm.
compound in pharmacy to work with, it either has to be a component of an approved FDA product
Hmm.
already, or on the safe standard list as far as the bulk ingredients from the FDA. So it's not like you can go and randomly decide you're going to pull anything that you want to use in compounds. It's very restricted. So you have
Hmm.
USP guidelines, FDA guidelines, and then you use what's approved on the market. And this is one of those things where, with time, I think we see some really nice progress towards the acceptance and really the development of better understanding, but it does take
Hmm. Yes, but that is a good point, is that you can't just compound anything, but those ingredients have to already be present or approved by the FDA for compounding. And so, and then there's strict guidelines for what you can do,
Sure.
with it. So, no, I think we've driven the point. I think that compounding pharmacies have been a crucial part of, hormone replacement therapy for men and for women. And even when it comes down to pellet use. And so I think that there's a lot of misperceptions out there. And I don't think that the physicians talking about it really understand it, quite frankly, that they don't understand the regulations that go into, anything that's for patient use in the US that's being used for hormones. Because there are no, for instance, and you'll know this, no testosterone approved products for women, but
Right.
we use testosterone in women.
Absolutely.
And so the guidelines are recommending that we use male conventional, like an FDA approved conventional product for women. But then we'll talk about how, pellets aren't FDA approved and shouldn't be used. And so there's just a lot of misinformation out there.
Sure.
And so,
And again, it's almost contagious because one person says it and then the next person says it louder. So it must be true.
yes,
But
must
yeah,
be. But thank you for taking time out of your day and having this discussion with me. It was super helpful. And we will be in touch for sure. I want to look at your compounding pharmacy and everything that you're doing. And then we will plan another podcast. Okay, Greg?
sounds good. I appreciate it.
All right. Thank you so much, Greg. Have a
Thank
great
you.
day.
Bye bye.